Health authorities are concerned that diabetes is increasing at an alarming rate in the state's indigenous communities, where it's referred to as the silent death. Diabetes Queensland says Aborigines and Torres Strait Islanders are up to 4 times more likely to contract the disease than non-Indigenous people. And as Kim Lyle reports, that's prompted a new approach in the fight against the disease.
GERRY Buckle is one of thousands of Australians living with type 2 diabetes, and he represents a group in the population that is suffering much more than others.
When I was 15 years old, and a doctor diagnosed me as being a mild diabetic. Mild diabetic? Well, didn't really know what that was.
Okay, thanks, Jerry. Hop off. You've lost some weight. Doing good.
It wasn't until later on in my life that I actually realised how bad diabetes was. I continued to do the things that drinking, the going out, the partying, eating of the hamburgers.
Is it a bit smaller than what it is? Yeah, so portion size is the key.
He says he now understands how to manage the disease, but it's taken its toll.
Since I've had amputations on my left foot, of all my toes, and one toe off the right foot as well. What is the portion for that?
For GERRY Buckle, education was the key. Diabetes Queensland is taking a new approach to educating more Indigenous Australians through theatre.
So what's that medication do for you?
Well, it fixes everything up. It means I don't really have to change too much. This medication will do it for me.
Oh, yeah. I don't know, Dad. You know?
The possibility is that if we see that this is a really useful engagement tool amongst community around this issue, then the possibility is that this tool will then be used in other states around diabetes, around how to connect community with diabetes.
In Queensland, the rates of type 2 diabetes in Indigenous communities have jumped dramatically. In some, they've more than doubled. A snapshot comparing statistics from 2007 to 2010 illustrates the concern. At Mapoon in the Gulf country, 60% of the community now has the disease. 3 years ago, it was just 23%. In Croydon, the rates are currently at 56%, up from 21%. At Wudjil, almost half the population is affected, up from 17%. And at Cherbourg, 28% are affected, up from 19.3% 3 years earlier.
I think probably the theory is that the way they lived previously, they were, as a community, they hunted for their own food, and they were tall and a slim sort of community, and now, of course, within this culture of ours, the changes in diet has changes the way that their body shape is.
Government regulation has also been blamed for taking away traditional food sources.
Nowadays you've got to have a certain size fish before you can bring it home. Aboriginal people used to go out and just get fish for a feed. Even with, say, other seafoods like turtle and dugong that coastal Aboriginal people lived on. It's, restrictions are on that, so you can't really go out and get it. So there's a number of things that really needs to be examined.
Looking around our community now, we can see a lot of people without legs, amputations on their arms and that. So it's having a big effect on the Indigenous people of Australia now, realising that this, as they call it, the silent death, is more prominent today than it was yesterday.
As GERRY Buckle nears 50, he's treating the condition with a new, hard-earned respect.
My mother's family, all her brothers and sisters had died from some cause of diabetes as well, and a few of my cousins have since passed on with a diabetes-related illness as well.